Okay. Good morning, everyone. I'm Carmen Stumple, President and CEO of Orillia Soldiers Memorial Hospital. It's my pleasure to welcome everyone here this morning. We are always thrilled to have our special guests return, the Honourable Sylvia Jones, Deputy Premier and Minister of Health, along with the Honourable Jill Dunlop, Minister of Colleges and Universities, and Simcoe North MPP. I'll start by acknowledging that we are situated on the traditional territory of the Anishinaabe Nation. We acknowledge the enduring presence of First Nations, Métis, and Inuit peoples of this region, specifically the Tri-Council First Nations comprised of Beausoleil First Nation, Chippewas of Rama, and the Chippewas of Georgina Island. We also acknowledge the Moose Deer Point First Nation, the Wata Mohawks, and the Georgian Bay and Moon River Métis councils. It should also be noted that the Wendat and the Haudenosaunee nations have also walked on this territory over time. This land acknowledgement represents a personal and organizational commitment to continually learn about Indigenous history so we can better support and co-create Indigenous health services for the communities we serve. Miigwech. What an exciting time it's been for our hospital. Did I mention we are thrilled to have Minister Jones and Mr. Dunlop here today? When last year in October 2023, along with the Premier, we had a $25 million funding announcement. We are pleased to report back on how that investment has already been put to good use to accommodate the incredible growth in our community. We are now operating 60 additional beds and are better able to meet the increased emergency department and inpatient care demands. We have increased the volume of surgeries by more than 1,000 from the previous year, doubling the volume of orthopedic cases. We have created an in-hospital critical care response team to support the urgent care needs across the hospital. And lastly, through our partnership with the Couchiching OHT, we are exceeding our targets for in-home care through the Couchiching Health at Home program. There are more examples, but I think you get the picture. It's been a busy 8 to 9 months, and we can't wait to hear what's next. Thanks to Minister Jones, we have a lot to be excited and grateful for, and it's my pleasure to welcome Deputy Premier and Minister of Health, Sylvia Jones.
Well, happy rainy Wednesday, everyone, and it is indeed a pleasure to be back here in Soldiers Memorial. I want to say, you know, you have an incredible MPP with Jill Dunlop. We often talk about our government approach to issues, and it's been an absolute honor and pleasure to be able to work so closely with the Minister of Colleges and Universities to work on some of these projects, building our health human resources. And I just want you to know what a strong advocate you do have at Queen's Park, and what a pleasure it is to be able to work with her alongside her in caucus and, of course, in cabinet. And, of course, especially when it comes to growing our health care workforce now and for decades to come. On behalf of Premier Ford and our entire government, I want to again thank the entire team at Orillia Soldiers Memorial Hospital for all you do to provide care to patients and their families each and every day. Under the leadership of Premier Ford, our government is making record investments in our healthcare system, and we are seeing results. Our plan is called Your Health, a plan that is focused on taking bold, innovative, and creative action to connect Ontarians to the care they need close to home by expanding capacity, shortening wait times for key services, while continuing to grow and support our province's highly skilled healthcare workforce. Over the last year, our government has made critical changes to provide people with the right care in the right place. We have had 2 record-breaking years in a row, registering a total of 32,000 new nurses, with another 30,000 nursing students currently studying at Ontario's colleges and universities. We have broken down barriers for internationally educated nurses, making it faster and easier to register to work in Ontario, while allowing healthcare workers registered in other provinces and territories to immediately start working here in Ontario. And we've expanded the Learn and Stay grant to provide eligible students in nursing with funding for tuition, books, and other related educational costs. To support nurses currently in the profession, our government has removed financial barriers for those wanting to upskill, launched the Clinical Preceptor Program that pairs experienced frontline nurses with new graduates, internationally educated nurses, or those looking to upskill to ensure they have the support they need, and make changes to allow our province's highly skilled healthcare professionals to work to the full extent of their training and expertise to provide patients and making care more connected and convenient. This includes expanding the role of registered nurses to prescribe medications and treatments. To date, we are excited to celebrate that 122 registered nurses have been authorized to prescribe, with close to 300 more prepared to take the required education. Today, I'm pleased to announce that our government is continuing to build a stronger, more resilient healthcare workforce by investing an additional $10 million to support 1,000 nurses to upskill their training to provide emergency department care. Through a variety of initiatives, such as virtual training modules, immersion programs to support hands-on education, and a specialty training fund, our investment will bolster, stabilize, and maintain the nursing workforce in emergency departments across Ontario, especially in rural and remote hospitals, to connect more people to critical care close to home. Today's exciting announcement is part of our government's $743 million investment over 3 years as part of our 2023 budget to continue to address immediate healthcare staffing needs and grow our healthcare workforce to ensure high-quality healthcare delivery across the province for years to come. And it is one more way our government is supporting innovative solutions to support patients receiving connected and convenient care close to home. Thank you again to Orillia Soldiers Memorial Hospital for hosting today, and I look forward to our continued working together as we work closely with our healthcare partners to build a stronger healthcare system in Orillia and across Ontario. It's now my pleasure to invite Minister Dunlop to share a few words. Thank you.
Oh, good morning, bonjour, Annie. It's always great to be back at Orillia Soldiers Memorial Hospital, and always a treat when I'm joined by my colleague, the Minister of Health and Deputy Premier Sylvia Jones. And Minister Jones, it's great to have you back again. We were at Waypoint last week, so when I told you that we hit the ground running in North Simcoe, we certainly do. Thank you for being here, and your presence underscores the importance of today's event, and I'm incredibly grateful for your support and your partnership. Minister Jones and I have worked together on several projects over the years, and I look forward to continuing the momentum to train and upskill Ontario's healthcare workforce. Today marks a pivotal moment for our community and for all hospital emergency departments in Ontario. Our government is helping to build a stronger, more resilient healthcare workforce in the communities that need it most. We are here today to highlight just how important our emergency rooms are, and of course, where would they be without our nurses? So often the first point of contact for those in need of critical care. The ability of our nurses to respond swiftly and effectively can make all the difference in those crucial moments. And families can feel confident knowing that in times of crisis, they will receive the highest standard of care from a team of well-trained professionals like those here at Orillia Soldiers Memorial Hospital. Thank you again to Minister Jones, Carmen, Jill, and the incredible hospital team for having us today. Together, we are building a stronger, healthier future for all. Thank you. Merci, miigwech.
Good morning, everyone. It's my pleasure to share the podium with the Honourable Ministers, Jones and Dunlop, this morning, and to thank them for their ongoing investment in nurse education. I've had the privilege to serve here as the Chief Nursing Executive at Orillia Soldiers for the past 5 years, and I've been a registered nurse for 25. Like hospitals across the province, OSMH is deeply committed to skills development for all nurses. Here in Orillia, we've built strong working relationships with our local education partners, Georgian College and Lakehead, to build a pipeline of health human resources for years to come. Each year, more than 300 nurses are trained here at OSMH. Maintaining and upgrading skills nursing is critically important, not only enhancing quality of care and access to care for our patients and families, but it also supports a high-functioning healthcare team by increasing morale, improved teamwork, reducing scheduling gaps, building a reputation for excellence that helps to drive both recruitment and retention. In closing, I'd like to thank Minister Jones for choosing our hospital to make this announcement today. Your visits always bring a level of excitement to the team. With the development of new and innovative programs to grow, strengthen, maintain the nursing workforce, including upskilling of more nurses and creating more training and mentoring in hospitals, we're helping to ensure the delivery of quality care now and into the future.